Now, there's one big thing that everybody kind of definitely wants me to talk about this. Open heart surgery भनेको चाहिँ के हो, Dr. Sir?
So open heart surgery भनेको चाहिँ is basically, so when we, so this is, heart surgery is very fascinating, okay? So it's not very old. It's compared to other surgeries, it started maybe in 1950s only, okay?
In the world?
Yeah.
Okay.
So the modern heart surgery. So before, actually the surgeons itself would say anyone who touches the heart should be kicked out of the profession because it was 100% mortality. So anyone attempted to do any form of surgery in the heart means this guy is not a good guy.
Yeah.
He doesn't have he doesn't have discipline, and he should be removed from the profession. So when it started off, it's amazing. This is the only surgery where you had 200% risk initially when it started off.
In the 50s?
Yeah. So 200% risk is, so when we do surgery, you need there's a machine. It's called a heart-lung machine.
Okay.
So the machine works as a heart. It pumps. And then there's a lung component which provides oxygen. So through pipes, so it's open heart is like you open the chest. The heart is here on your left side. And then through tubes, we take the blue blood, that is the used blood, which doesn't have oxygen, goes into this machine. And then the machine provides the heart function. And the lung component provides the oxygen. And then through a pipe, you take it back into the main blood vessel. And it circulates to the entire body, okay?
Okay. This is the machine?
Oh, yeah, exactly.
That's
great.
the machine.
You guys are great, yeah. So that's the heart-lung machine.
Okay.
Okay? And then what we do is we give a special solution to the heart to stop it for some time, okay? And then we do the surgery, and after we finish the surgery, we revive it. Now, coming back to your 200%, so if, let's say, something goes wrong, it should be 100%.
Yeah.
So initially, before this machine was developed, they would have the father or the mother act as the heart-lung machine.
Oh. Paila.
That's how it started off. That's how innovation. So you'd have, let's say if a child is undergoing surgery, the mother or father would be beside. So something went wrong. You're actually looking at two deaths. Yeah. So that's how, it's amazing how this field is developed. And now, present time, if we do it in Nepal as well, so our temperature is 37 degrees. So we cool the body to 20 degrees through the machine. It's a very controlled decrease to 20 degrees. And we stop the circulation and do surgery also. So there's no blood flow. The heart is not working. There's no blood flow to the brain. The brain is...
It's frozen.
Yes.
Okay.
But you have a time frame, so it's like around 30 to 40 minutes. You finish the procedure, and then again through the machine, and then you gradually bring the temperature back up.
Hold on, this is okay. This is too much information for me. Hold on, this is too much information for me. Okay, hold on.
So science. This is
science.
Yeah.
Okay, I had no idea that you can freeze a human being right now and then
freeze in the sense. So 20 degrees is not frozen.
Okay, yeah.
So you wouldn't go below 18.
Okay.
So I think you might have heard stories, like where someone, especially in America, winter we don't get too much of the Himalayas climbing. We had one person from Malaysia, actually a climber. He was lost for 2 days, and then when he came in, he was hypothermic. But if you look at you'll get stories in Europe and US, like someone got lost and he was hypothermic, and then they brought him back, and then they warmed him, and then
he was back.
Yeah.
He or she was back.
Yeah. Some of them, they may have some defect or whatever, but then was back. So it's basically these things. So like science does amazing things.
This program is brought to you by Vyas Studios.
Thank you very much for supporting the podcast so far. And if you want to see more content, more shows, then make sure that you subscribe to our channel.